Hello, everybody. Welcome to this BioIT World Symposium, sponsored by DecisionView. Today's topic, clinical operations, challenging conventional wisdom can work. I'm Kevin Davis, the founding editor of BioIT World and the author of the new book, The $1,000 Genome, and I'm delighted to be hosting today's webinar with three fantastic speakers on tap, who I will be introducing in just a couple of minutes. So as we will be discussing in today's webinar, indeed at length in the upcoming January-February issue of BioIT World magazine, clinical operations is under intense pressure to dramatically reduce costs while increasing productivity. That's no news to anybody on this call. But is a do more with less approach sufficient? Can we really continue to operate as we have for the past 10 or 20 years and expect better results? Or do we need to challenge ourselves to think differently, question conventional wisdom, and embrace potentially disruptive innovations that could dramatically change this cost-productivity equation? I recently was at a conference and heard Hal Barron, the Chief Medical Officer of Genentech, say something that got my attention. He said, the solution is, in fact, to take longer and spend more, but to do so at the right time. This web symposium explores the scale of operational change that is needed to improve clinical operations by examining some specific disruptive innovations that are being pursued by leading organizations, some of those solutions that you'll hear about in the next 90 minutes or so. Among what we hope will be discussed today are conventions that you could and should challenge to spark change in your organization, the 7 myths of clinical operations, why doing nothing is not an option, and some of the specific tools, resources, and strategies that are required to improve results. We're hopeful that our guest speakers will have fairly succinct presentations, about 20 minutes each or thereabouts, which should allow us ample time at the end to take your questions, which, as Elizabeth mentioned, you can type in at any time using the interactive dialog box, and we will queue up as many as we possibly can and squeeze in the time that we have allotted. So, without further ado, I'm going to introduce the first of our speakers. A little later, you'll hear from Linda Drumright, the President and COO of DecisionView, as well as Brendan O'Neill in the Global Trial Optimization Group at Merck. But first off is Alka Goel from McKinsey & Company. Alka is a principal in McKinsey's New York office and a core member of the pharmaceutical and healthcare practice of the company. She also leads McKinsey's Clinical Trial Impact Service. Her forte is dealing with strategic, operational, and organizational issues with an emphasis on R&D productivity. She holds a BA in economics from Delhi University and an MBA from the India Institute of Management. Alka, delighted to have you join us, and I'm going to pass the ball over to you.
Thank you, Kevin. Thank you for the kind introduction. The fact that we are having a web symposium reaching out to hundreds of attendees who are sitting in the comfort of their offices makes me believe that disruptive change is possible. And what I'm going to share with you is not necessarily prescriptive solutions today. It's really sharing some ideas to spur thinking, to challenge conventional wisdom, and have a discussion and debate around this. With that, I'll go to my first slide. I think you've seen this before. As Kevin mentioned, this is no new news. R&D productivity has been on the decline since decades now. You've seen an increase in R&D expenditure, decrease in the number of NME approvals, and you've probably seen this data cut several different ways. In fact, an analysis that we did internally shows that the cost of capital now exceeds the IRR for most small molecules. This is actually a very similar situation, even in biologics, slightly better, but with increasing competition, you begin to see that trend here as well.